It can be a quiet, personal worry. You might notice that your interest in sex has faded. What used to be a source of pleasure and connection now feels distant or like a chore. This feeling can be confusing and even a little scary. You might ask yourself, is something wrong with me? Or why don't I feel the way I used to? These thoughts are completely normal. Many people, at some point in their lives, experience a dip in their sexual desire. It's a topic that we often don't talk about openly, which can make you feel isolated and alone in your experience. But I want to start by telling you something very important. You are not alone. The truth is, a decrease in sexual desire is one of the most common sexual health concerns that people bring to their doctors. It affects individuals of all genders, ages, and backgrounds. The reasons for this change are as varied as the people who experience it. Life is complex, and our bodies and minds are constantly responding to the world around us. Your sexual desire is not a simple on or off switch. It is a delicate part of your overall well-being. Feeling a lack of desire does not mean you are broken or that your relationship is doomed. It is simply a signal from your body that something has shifted and needs attention. In my years of helping people with their sexual health, I have seen how this issue can create stress and anxiety. You might worry about disappointing your partner or feel a sense of loss for a part of yourself. This is a sensitive topic, and it's okay to feel whatever emotions are coming up for you. The first step toward feeling better is understanding that this is a shared human experience. By reading this, you are already taking a positive step. You are seeking information and acknowledging your feelings, which is a brave and crucial part of the healing process. This essay is here to be your guide. We will walk through this topic together, step by step, in a supportive and non-judgmental way. We will explore what sexual desire is, why it can change, and what you can do about it. My goal is to give you clear, simple information that empowers you. Knowledge is the first tool you need to understand what's happening and to find a path forward. Remember, a change in desire is not a personal failure. It is a health issue, just like any other, and there are many effective ways to address it and rediscover your vitality. So, what do we mean when we talk about sexual desire? You might hear it called libido or sex drive. Simply put, sexual desire is your interest in sexual activity. It's the thought, fantasy, or feeling that motivates you to seek out sexual experiences. It's that internal spark that makes you feel in the mood. This feeling can be spontaneous, popping into your head without any specific trigger. It can also be responsive, meaning it arises in reaction to something, like a touch from your partner or an intimate moment. Both types of desire are perfectly normal. It is incredibly important to understand that sexual desire is not a constant. It naturally fluctuates throughout your life, and even from day to day. Think of it like your appetite for food. Some days you might feel very hungry, and other days you might not have much of an appetite at all. Your libido works in a similar way. It can be influenced by so many factors, such as your energy levels, your mood, and what's happening in your life. There is no correct amount of sexual desire. What feels normal for you might be different from what feels normal for your friend or your partner. Your baseline level of desire is unique to you. Some people naturally have a very high sex drive, while others have a more moderate or low level of interest, and that's perfectly fine. A change is only really a problem if it is causing you distress or creating issues in your life. The key is the change from what is normal for you. If you have always had a low-key libido and are perfectly happy with it, there is no issue to solve. The concern arises when you notice a significant and persistent drop from your personal baseline. Understanding that desire varies is the first step to letting go of any guilt or pressure you might feel. It's not a competition. Your journey with your sexuality is your own. It will have peaks and valleys, moments of intense connection, and moments of quiet. The goal is not to have a constantly high sex drive. The goal is to have a level of desire that feels healthy and fulfilling for you. Recognizing that desire is a dynamic and personal experience allows you to approach any changes with curiosity and compassion, rather than with fear or self-criticism. When your sexual desire takes a nosedive, it's natural to wonder why. The answer is rarely simple, as our libido is connected to our mind, body, and life circumstances. Let's start with psychological factors, which are very powerful. Stress is a major culprit. When you're constantly worried about work, money, or family, your body is in fight or flight mode. It produces stress hormones like cortisol, which can seriously suppress your sex drive. Your brain is so busy managing threats that it puts sexuality on the back burner. Similarly, mental health conditions like depression and anxiety are well-known desire killers, as they can drain your energy and pleasure from all areas of life. Hormones also play a starring role in regulating our libido for both men and women. For women, hormonal shifts during the menstrual cycle, pregnancy, postpartum, and especially during perimenopause and menopause can cause desire to fluctuate or decline. A drop in estrogen can lead to physical changes, like vaginal dryness, that make sex uncomfortable and therefore less desirable. For men, low testosterone, sometimes called low T, is a primary hormonal cause. Testosterone is the main hormone driving male libido, and when levels drop due to age or other health conditions, a man's interest in sex can decrease significantly. Your physical health is deeply intertwined with your sexual health. Living with a chronic illness such as diabetes, heart disease, or arthritis can impact desire in many ways. The illness itself can cause fatigue, pain, or changes in body image that make sex less appealing. Furthermore, many medications used to treat these and other conditions can have low libido as a side effect. Common examples include certain antidepressants, blood pressure medications, and hormonal contraceptives. It's a frustrating cycle where the treatment for one problem can inadvertently create another. Finally, your daily lifestyle habits have a huge effect on your sex drive. Things like not getting enough sleep, eating a poor diet, drinking too much alcohol, or using recreational drugs can all deplete your energy and dampen your desire. A sedentary lifestyle with little to no physical activity can also contribute. On the flip side, relationship issues can be a powerful psychological barrier. Unresolved conflicts, poor communication, or a lack of emotional intimacy with your partner can make it very difficult to feel sexually connected and interested. Your body and mind need to feel safe and connected for desire to truly flourish. It's normal for your interest in sex to ebb and flow, so how do you know when a dip in desire is something you should actually be concerned about? Not every lull in your libido is a red flag. You might be tired after a long week, feeling under the weather, or just going through a busy period where sex is not your top priority. These temporary dips are a normal part of life. The time to pay closer attention is when the change becomes persistent. If your lack of desire lasts for several months and doesn't seem to be getting better on its own, it might be more than just a passing phase. The most important factor in determining if low desire is a problem is how it makes you feel. Is this change causing you personal distress? Do you feel sad, frustrated, or worried about your lack of interest in sex? Do you miss the way you used to feel? If the answer is yes, then it is a valid concern worth exploring, regardless of how often you are or aren't having sex. Your feelings matter. Your sexual health is a part of your overall well-being, and if it's causing you emotional pain, that is reason enough to seek answers and support. Your happiness and quality of life are the ultimate measure. Another key indicator is the impact on your relationship. While your desire is personal, sex is often a shared experience with a partner. Is your low libido causing tension, arguments, or emotional distance in your relationship? Does your partner feel rejected or confused? When a change in one person's sex drive starts to negatively affect the connection and intimacy you share as a couple, it becomes a relationship issue as well as a personal one. Addressing it is not just about sex, it's about preserving the health and happiness of your partnership. Open communication about this is crucial, though often difficult. So, to summarize, you should consider seeking help for low sexual desire if it meets one or more of these criteria. It is persistent and has lasted for an extended period. It is causing you significant personal distress, anxiety, or sadness. Or it is creating conflict and damaging the intimacy in your relationship. If you're simply in a temporary lull and it doesn't bother you, there's no need to panic. But if your lack of desire feels like a heavy weight on your mind or your relationship, know that it's a legitimate health concern, and it's a very good reason to talk to a professional. Deciding to talk to a doctor about low sexual desire can feel intimidating, but it is the most effective step you can take toward finding solutions. Knowing what to expect during the evaluation can help ease any anxiety you might have. Your doctor's primary goal is to be a supportive detective, helping you uncover the root causes of your changing libido. The first and most important part of this process will be a conversation. Your doctor will ask you questions about your health, your life, and your specific concerns. This is called taking a medical and personal history. During this conversation, your doctor will want to understand the full picture. They will likely ask when you first noticed the change in your desire and how it has evolved. They'll ask about your general health, including any chronic illnesses you have, and any medications you are taking, including over-the-counter drugs and supplements. They will also gently inquire about your mental and emotional well-being, asking about stress levels, mood, and symptoms of depression or anxiety. It is also important to discuss your lifestyle habits, like your diet, exercise, sleep patterns, and alcohol use. Be as open and honest as you can. Your doctor is there to help, not to judge. Depending on your specific situation and symptoms, your doctor might also ask questions about your sexual history and your current relationship. They might want to know if you experience pain during sex, if you have trouble with arousal or orgasm, or how the communication is with your partner. This information helps them distinguish between a primary issue of low desire and desire that is low because of another sexual dysfunction. While these questions can feel very personal, they provide crucial clues that help your doctor pinpoint the problem and recommend the most effective treatment for you. Finally, based on your conversation, your doctor may recommend some tests. A physical exam might be part of the evaluation. For many people, blood tests are a key step. These tests can check your hormone levels, such as testosterone for men and estrogen, progesterone, and testosterone for women. Blood work can also screen for underlying medical problems that might be affecting your libido, like thyroid issues, diabetes, or high cholesterol. This evaluation process is thorough for a reason, to make sure that no stone is left unturned in finding the cause of your low desire, so that you can get the right support and treatment. Once you and your doctor have a better idea of what might be causing your low libido, you can start taking practical steps to address it. The treatment plan will be tailored to you, as the solution depends entirely on the cause. If psychological factors like stress, anxiety, or depression are the main culprits, managing your mental health is the top priority. This could involve learning stress reduction techniques like mindfulness, meditation, or yoga. For depression or anxiety, therapy with a counselor or psychologist can be incredibly helpful. In some cases, your doctor might suggest antidepressant medication, though you should always discuss how different options might affect libido. If a hormonal imbalance is identified through blood tests, your doctor may discuss hormone therapy. For men with clinically low testosterone, testosterone replacement therapy can be very effective at restoring libido, energy, and mood. For women, especially those in perimenopause or menopause, estrogen therapy, often in a localized form like a cream or ring, can alleviate vaginal dryness and discomfort that makes sex unappealing. Sometimes, a low dose of testosterone is also prescribed for women to help boost desire, though this is an off-label use that should be carefully discussed with your doctor. Correcting the hormonal imbalance can often bring the spark back. Addressing physical health and lifestyle factors is another powerful way to take charge. If a chronic illness is contributing, working with your doctor to manage it better can improve your overall energy and well-being, which in turn can help your libido. If a medication is the likely suspect, ask your doctor if there are alternative drugs you could try. Simple lifestyle changes can also make a world of difference. Prioritizing sleep, incorporating regular exercise into your routine, and eating a balanced diet can boost your energy and mood. Reducing alcohol intake is also a smart move, as alcohol is a known depressant that can dampen desire. Finally, never underestimate the power of communication and connection. If relationship issues are playing a part, it's time to talk. Set aside a calm moment to speak openly and honestly with your partner about how you're feeling. Use I statements to avoid blame, such as "I've been feeling a lack of desire lately, and it's making me sad." A couples counselor or a sex therapist can provide a safe space and tools to help you and your partner navigate this issue together. Rebuilding emotional intimacy is often the first and most important step to rekindling physical intimacy. As we come to the end of our discussion, I want you to hold on to one central message. There is hope. Experiencing a loss of sexual desire can feel isolating and discouraging, but it is a profoundly common part of the human experience. You have not failed, and you are not broken. Your body and mind are complex, and your libido is simply one reflection of your overall health and wellness. Life brings changes, stress, illness, hormonal shifts, and relationship challenges, and it is completely normal for your sex drive to respond to these things. The most important thing is that you are not alone in this journey. The path to rediscovering your desire begins with compassion for yourself. It's about letting go of guilt and replacing it with curiosity. By seeking to understand the why behind your change in libido, you are empowering yourself to find the right solutions. We've seen that the causes are numerous, ranging from the psychological to the physical. But for each cause, there are effective strategies and treatments available. Whether the answer lies in managing stress, balancing hormones, changing a medication, or improving communication with your partner, a solution is within reach. You do not have to simply accept low desire as your new normal if it is making you unhappy. This is my encouragement to you. If your low libido is persistent and causing you distress, please take the next step. Reach out to a healthcare professional you trust. A compassionate doctor, therapist, or counselor can be your greatest ally. They can provide a safe space to talk, help you investigate the underlying causes, and guide you toward a treatment plan that is right for you. Making that first appointment can feel like the hardest part, but it is a powerful act of self-care and a commitment to your own well-being and happiness. Remember, your sexual self is a vital part of who you are, and it deserves care and attention just like any other aspect of your health. Reclaiming your desire is not always a quick or easy process, but it is an achievable one. With the right support, information, and a little patience, you can navigate this challenge. You can work toward restoring that sense of vitality, pleasure, and connection in your life. The horizon is hopeful, and the journey back to yourself is one that is absolutely worth taking. You deserve to feel whole, healthy, and happy.